Hi, everyone, and thank you for joining today's Take 10 chat, where we share experiences of apheresis healthcare providers and clinicians from around the world. In honor of World Blood Donor Day and World Sickle Cell Day, today's chat will be focused around the importance of donating blood and some of the science behind ethnically matched blood types. Today, we are joined by Dr. Erin Goodhue, pediatric transfusion and apheresis tending physician and previous executive medical director of direct patient care at the American Red Cross. Dr. Goodhue has recently joined us at Terumo Blood and Cell Technologies as the Director of Clinical Affairs. So welcome, Dr. Goodhue, and thank you so much for joining me today.
Oh, thank you so much, Caitlin. It is my pleasure to be here today.
So let's get started with some of the basics. So why are blood donations so important, and especially for individuals with sickle cell disease?
Well, there has been and is excellent ongoing research into treatment options with patients with sickle cell disease, including several approved therapies over the last several years. Red blood cell transfusion, red blood cell exchange still remains a cornerstone of both primary and secondary stroke prevention for these patients. Luckily, with excellent screening, this devastating complication is much less common than it was previously, but it still is still a potential complication of the disease.
And so what does it mean then to have a successful blood transfusion or red blood cell exchange?
A successful red blood cell transfusion or red blood cell exchange kind of works in two ways. When it's done for an acute complication, it can really rapidly decrease the level of sickle cell hemoglobin in the patient's blood. And when done kind of chronically ongoing, it can help decrease the body's ability to make more red blood cells with sickle cell hemoglobin.
And we hear a lot about antigens, and we know that there are different blood types. So how do antigens affect a blood transfusion and a patient's clinical outcome?
So red blood cell antigens are molecules on the surface of the red blood cell that aid in the physiologic function of the red blood cell. They can be proteins or sugars. And these molecules are, like everything else, determined by genetics. And if you're transfused a red blood cell unit from a donor that has molecules that are different than yours, there's a potential that your body could see them as foreign. And if your body and your immune system see them as foreign, sometimes, and that's something we're still trying to understand, sometimes it can mount an immune response that could cause the destruction of those red blood cells.
And so along with that, what are some of the misperceptions that we commonly hear about blood types and diverse blood types that you would like to help others understand?
Great question. I think we're still very much in the early stages of learning about different antigens. In my more years than I'd like to count in this field, we have definitely learned so much, and there's still so much to learn. And we're still trying to understand how ethnicity, and race impacts antigen expression. But I cannot underscore, particularly for patients with sickle cell disease, how important it is to have a large, diverse blood donor pool to draw from to meet the needs of these patients.
And I know this is always a difficult topic, especially as we're learning more. As you mentioned, it's something that we're starting to get more research and data on. So is there anything else on this topic that you'd like to share with the sickle cell community about blood transfusions or exchanges and just donating blood?
Yes. So it is very important for patients with sickle cell disease to receive red blood cells that have antigens, or the molecules on it that match their own, so that they're not destroyed by their immune system. The best way to start looking for that type of blood is by having many options available of many diverse blood types. And obviously, the best way to do that is to look for ethnically matched blood. For certain patients with sickle cell disease, red blood cell transfusion and red blood cell exchange can be not only life-saving at times, but life-altering. If you are able to donate blood, please help join the efforts to help treat this very vibrant patient population.
Well, thank you so much, Dr. Goodhue, for joining me today and for your expertise. We hope you all enjoyed this Take 10 chat, and we'll see you next time.
Thank you.